to have cancer is not great, but everyone's been accommodating.
Although removing a kidney is a major operation, doing it with minimally invasive surgery or keyhole surgery means that we're turning a major operation into slightly less of an ordeal for the patient. This means that your recovery is a lot quicker. It means that you lose less blood during the operation, you're in less pain after the operation, and you can get back to your normal life a lot quicker. You'll be seen by your anaesthetist and also by the surgical team on the morning, and they'll answer any questions that you may have. When you get taken down to the operating room, you'll be accompanied by one of the nursing staff, and then you'll meet the anaesthetic team again, who will be putting you to sleep.
And when you wake up, you're going to find that you have a small tube through into your bladder that would drain the urine, and you may feel a little uncomfortable because of that, and you will start feeling generally a slight amount of discomfort around the wounds that we have on the tummy, which are going to be nothing more than 2 centimeters. Most of the wounds will have sutures that are under the skin. You won't see them from outside, and they will heal on their own.
Patients are generally surprised, especially after keyhole or robotic surgery, that they generally only need 1 night in hospital, sometimes 2. Every patient is different, so when you go home might be different to when someone else will go home, but the standard admission time would be about 1 to 2 nights. The day after your surgery, it is imperative that you get up and move, and that's probably one of the key parts of your recovery. Gentle movement. As I always say to patients, we're not expecting you to run a marathon, but just to get out of the bed and gently move around. This stops you from getting a chest infection. It helps expand your lungs, regulates your breathing. It also prevents you from getting a blood clot, which is really important. You'll also notice that your bowels won't go for a number of days after surgery. Again, this gentle movement will help getting your bowels going again. It's normal for the bowels not to go for 5 to 7 days. They will go with time.
It's very important to plan to either have family or to have friends that are available to support you on discharge. Things like ensuring you have meals made up in the freezer ready so you don't have to cook are really good tips, because you will not feel like going to do the shopping. So having friends that can get milk in and fresh bread, it's really useful until you've recovered and you're able to do these tasks yourself.
And I think patients are surprised at how long this exhaustion takes to pass after the surgery, and can extend well past their physical recovery. Again, this is a normal part of having had an operation on your kidney, and it's natural to need to nap or sleep more than you would have been used to prior to coming into the hospital.
You should go home with some adequate pain relief, but if you do need more, you can always ask your GP or get in touch with us.
An end of treatment clinic will be organised for you, and your nurse will complete an end of treatment summary. This document will summarise the treatment you have had, the ongoing scans you need to have to do in the future to ensure there's no recurrence, and the potential side effects to look out for where you may be indicated to ask for some medical advice. The end of treatment clinic summary will be sent to your local hospital and to your GP, so ongoing support can be organised in primary care.
Now that I've gone through this, life-changing, life-threatening experience, what matters in my life? How am I going to move forward?
It's often the case that the reality of what you've been through doesn't actually hit you until quite some time after the main part of your anti-cancer treatment is over. At Macmillan Cancer Support, we don't go anywhere, so we will be right here whenever you need us, for as long as you need us.